Hi, this is Mattis here, and today I'll be talking about some objectives for Unit 3, Anatomy of Intubation, Larynx. So our first objective is talking about some features of cricoid cartilage. So it's a hyaline cartilage. It's unpaired, so it's a single cartilage, and it's the major attachment sites for intrinsic and extrinsic laryngeal muscles. It is the most inferior of laryngeal cartilages. It sits at the level of C6, cervical vertebra number 6, completely encircles the airway. It's shaped like a ring. It has a broad lamina posteriorly and a narrow lamina anteriorly. So the posterior surface of the lamina, as you can see in this picture, is characterized by two shallow oval depressions separated by a vertical ridge. Esophagus attaches to the ridge, and the depressions are attachment sites for posterior cricoarytenoid muscles. The cricoid cartilage has two articular facets on either side for articulation with other laryngeal cartilages. One facet is on the sloping superior lateral surface of the lamina, articulates with the base of arytenoid cartilage here, and the other facet is on the lateral side of surface of the lamina, near the base, and it articulates with the medial surface of the inferior horn of thyroid cartilage, as you can see here. So superiorly, it articulates with the arytenoid cartilage and inferiorly with the thyroid cartilage. Next, we'll talk about epiglottis and its anatomical features. It's an elastic cartilage. Again, it's unpaired. It's a single cartilage. And the major action that it does is preventing foreign bodies from entering the larynx. Overall, it's leaf-shaped, and it's attached by its stem to the posterior aspect of thyroid cartilage, as shown here, at the angle, and projects posterior-superiorly from its attachment to the thyroid cartilage. The attachment is via the thyroepiglottic ligament in the midline, approximately midway between the laryngeal prominence and the inferior thyroid notch. The upper margin of the epiglottis is behind the pharyngeal part of the tongue. Here. And the inferior half of the posterior surface of epiglottis is raised slightly here to form the epiglottic tubercle. Next, we'll talk about the Malampati classification of airway. So the major anatomical features here that are important in this classification are the oropharyngeal pillars, uvula, hard, and soft palate. This classification basically examines the size of the tongue in relation to the oral cavity. The greater the tongue obstruction of the pharyngeal structures, the more difficult intubation is. Class 1 Malampati classification is when entire palatal arch, including bilateral pillars, are visible down to their base. Class 2, upper part of the pillars and most of the uvula is visible. Class 3, only soft and hard palate are visible, and Class 4, only hard palate is visible. In another classification, laryngeal view grading. The most important anatomical features here are glottis and epiglottis. We talked about epiglottis, which is one of laryngeal cartilages. Glottis is the narrowest part of the larynx that opens into the airway, and it's laterally surrounded by the vocal cords, as shown here. Grade 1 laryngeal view. Glottis is fully exposed, including its anterior and posterior commissures. In grade 2 laryngeal view, glottis is partially exposed. The anterior commissure is not visualized. In grade 3, glottis is not exposed at all. Epiglottis cartilage only is visible. And in grade 4, glottis plus the cartilages, none of them are visible. Grade 1 and 2 are considered adequate exposure. Grade 3 and 4 are considered inadequate exposure. That is it for today. Thank you for listening.